All right, we've got a lot to share today, so I'm going to go ahead and start us off. Welcome, everybody. We're excited to have you here. And on behalf of the Arlington Community Foundation, the Washington Forest Foundation, and 21 Arlington Safety Net nonprofits, we are so excited to share with you our report and the story of how we together rose to meet a historic level of need in our community. I'm Caroline Jones, the report's author, and also a longtime safety net leader here in Arlington. For decades, I've partnered with these nonprofits, county agencies, and leaders, and community members, and businesses, and many of you to do much good. I served as a safety net leader in the past year, and in the first year of the pandemic. And also during the time where a concurrent national crisis began with the murders of several Black Americans. Before the governor ordered shutdown in March of 2020, and continuing today, I've been so deeply inspired by the level of resolve and collaboration among safety net nonprofits and county agencies, with thousands of our neighbors immediately and continuously impacted by both of these crises. These organizations, with help from our community, have stepped up in ways unprecedented. While there's so many heroes from this time and who we appreciate immensely, this report focuses on these 21 nonprofits that together form Arlington's strong social safety net. Their vast missions and expertise meet the most basic and essential needs. Their missions simply cannot stop, not for a day. People count on them for food, for emergency rent and other emergency assistance, for housing and shelter, for healthcare, recovery, and mental health care, employment and legal services, transition supports, and childcare and education. In this time of emergency, the need for a highly coordinated and informed safety net was key in getting historic levels of government and philanthropic support relief to hundreds, where we could together prevent hunger, eviction, the spread of COVID, and many other forms of suffering. Partnering extensively with each other and many county agencies, these nonprofits have been our first responders and our last lines of defense for hundreds. We hope that this report sheds some light on what these organizations together accomplished and also what we learned along the way. I couldn't be more in awe of these organizations, and I'm honored today to be joined by 8 safety net leaders, the Arlington Community Foundation and the Washington Forest Foundation, who together sponsored this report. You'll hear from all of them in just a minute as they walk us through the report's insights and recommendations. And following this, we look forward to spending time with all of you and answering your questions. As they arise, please go ahead and post your questions in the Q&A section at the bottom of your screen, and we look forward to answering those at the end of the presentation. First, I'll get us started by sharing a bit about who the safety net organizations typically serve and how many of our neighbors were uniquely impacted in this time of protracted hardship. Safety net nonprofits commonly and primarily serve people who are living with very low incomes and in poverty. And in Arlington, that translates to 25,000 individuals who are living on incomes below roughly $39,000 a year. That could be for a family of 4. Also seniors and people who have special needs living on fixed incomes, and people who are in times of significant transition in their life, who maybe aren't earning any income at all, often also can need safety net supports. These households face significant hardship as they work to survive and thrive in Arlington. And when speaking about them, it's important that we note that their lack of resources is not due to personal failures, but in many cases, it's a direct result of policies that have failed them. They share a common humanity and potential. And it is incumbent and imperative that we acknowledge and amplify the role that centuries of structural racism and policy failure plays in our safety net missions. It's not coincidental that among our safety net nonprofits, historically and still today, we serve a disproportionate representation of Black, Indigenous, and people of color. Like every town in our nation, Arlington experiences racial disparities that are drivers behind tremendous hardship, and that these nonprofits witness daily. Yet in these 18 months of dual crises, it was so magnified, the cruelty, the injustice, and the uneven suffering that racism causes for our neighbors in these communities. Now think back to March of 2020. Think of that moment around the shutdown order, all of the unknowns and the chaos. Do we wear gloves? No, not gloves. Do we wear masks? Yes, all the time, just when? And how much we had to just keep going. And the months that came after, with people being so impacted and in all of the ways that people were affected by the beginning of the racial justice movement's most recent chapter. I don't think any person can say that they got through this very historic time unaffected. But it is absolutely true that the way that people were impacted differed greatly. On the economic front, working households here in Arlington that predominantly work in frontline services, food services, service, personal care industries, transportation. For so many of them, their jobs were instantly lost. Their incomes were abruptly stopped. And for many of these households, within the first months of bills, their savings was decimated. For working parents, the closure and hybrid schedules of the schools and childcare made returning to work in person difficult, if not impossible. Digital access barriers, or the digital divide, as we now have that term better understood, was so magnified in this time, when the world suddenly shifted to everything being virtual, how we got information, how we learned, and how we worked. For seniors and people with special needs, and those living in congregate settings like shelters, treatment centers, or incarceration, the heightened isolation and risk of COVID infection posed immediate challenges for many of these individuals to get services and support. Simply affording or accessing things like food or essential household items like cleaning supplies or diapers, medications, paying rent, affording internet, and healthcare quickly fell out of reach for many of our Arlington neighbors. And tragically, compounding these challenges, the rates of COVID infection and tragically mortality among Black and Latinx people in our community imposed tangible and terrifying consequences on these households and communities. Responding to this sudden and sustained rise in needs, many needs all at once, required an all hands on deck approach. Safety Net Arlington leaders, together with Arlington Department of Human Services fearless leader, Anita Friedman, and Arlington Public Schools amazing social work supervisor, Wendy Correa, convened weekly. They tackled problems as they were emerging and forged new pathways to get help to as many people as possible. Re-engineering our safety net 1,000 times over, nonprofits collected and distributed donated gift cards and goods, emergency relief funds, record level rent relief and food assistance, and importantly, provided a human connection and support and services to people who are undergoing extraordinary isolation and challenge. Despite what often felt like chaos, these incredible organizations expanded their offerings, their capacity, and their ways of doing to make it safe and easy for people to get help. In this time of crisis, we found ways to serve and support people that we thought impossible. We come out of it with things like telehealth and virtual services, and unconditional cash assistance. Now let's bring our panel of leaders to this discussion. We're eager to share with you, our community, in hopes that we can move forward from maybe a new starting place with the resolve to help our neighbors not just recover and heal, but to rebuild and renew after this prolonged time of hardship. So I'd like to welcome to the screen Debbie Taylor of National Capital Treatment and Recovery and Andrew Schneider of Arlington Thrive. Thank you, Andrew and Debbie. So Debbie, you've been one of the things that we've talked about in the Safety Net group, and what I learned so much from you all in my report was how lucky we felt that we had worked together in many ways as a safety net, and that this might have positioned us well in this time. So Debbie, you've been a longtime member of Safety Net Arlington in its many forms. What are your thoughts?
Well, thank you, Caroline. And I think that's a nice way of saying I'm the old lady on the bench. And it's true. I have had the fortune to be involved in this community since the mid 80s in many, many different capacities. And I have watched the nonprofit leaders, although the leadership may have changed, but the mission never went away. And Arlington County never went away. I mean, my first huge experience was when the HIV crisis hit in the 80s and the 90s. I mean, that was huge. Staff thought they were going to die. You know, we didn't know what to do. Do we wear gloves? What do we do? We hit the drug crisis that hit in the 90s as well. And we worked with the Partnership for Children, Youth, and Families. We have evolved throughout the years to be able to be what we need to be to provide the care to the disadvantaged in Arlington, regardless. And it's not that we're nonprofits, or I don't feel that I'm a member of a nonprofit organization. I feel I am so grateful to be involved with all of these experts who come to the table with their expertise on how to deal with their part of the problem. As we move more towards the more recent times, we see the Bridges Out of Poverty coming involved. We have the third healthcare strategic plan, Destination 2027, that I've been involved in, that has moved the organization, all partnerships, whether those be foundations, community leaders, elected officials, and again, the experts that exist in the nonprofit community. I think this has positioned us extraordinarily well for this particular crisis. And I know that Andrew may have comments about that on how it actually worked on a day-to-day basis. So thank you for inviting me.
Thanks, Debbie, and thanks, Caroline, and thanks everybody for being here today. It's been an honor being a part of this project, and it's been interesting to just think about how the pandemic really built upon, as Debbie was saying, decades of collaborative work going back to the AIDS crisis, the drugs crisis, the economic crisis in 2008. And the thing that was really unique about what we've learned about this crisis was that how it affected every aspect of the safety net, that it wasn't just related to healthcare, it wasn't just related to housing, it wasn't just related to food, it was all of it in the comprehensiveness of it. And if we had not had those kind of foundational collaborations that have been going on for many years, I think we were all impressed by how we were able to ramp up so quickly. And I think, to build upon what Debbie said, it wasn't just the speed and the alacrity with which the nonprofits built up, but it was the response of Anita Friedman and DHS moving so nimbly and aggressively, frankly, to put resources where they were most needed. That was housing and food, and making sure that people, especially in the early days of the pandemic, had the resources that they needed as things were just being figured out on almost on a day-to-day basis. And I think the final point that I would make is that we learned a lot, and what we kind of sometimes said in our bi-weekly and then monthly safety net meetings, that you never wanted to waste a crisis. And we put a lot of flexible practices in place during the pandemic, that we were able to change business as usual, whether that meant changing some of the requirements or loosening some of the requirements to get access to care, or at least get access to talk to somebody about care, to making the amount of time that people were eligible for assistance longer. and making sure that people were not put right back out into crisis once they received assistance. And I think those are the things that we'll be looking to our colleagues and the county leadership and the community to have a discussion about, whether we should be going back to the way we were doing things beforehand, or if this new way really shines a light on things that we could be doing better after the pandemic, which eventually we will be talking about after the pandemic.
Great. Thank you so much, Debbie and Andrew. We'll see you both again in just a couple of minutes. Thank you. Great job. So now let's look more closely at how Safety Net staff, particularly those with lived experience and connections in the communities they serve, as well as our organizations where we have leaders who are from communities, Black, Indigenous, and people of color, and how uniquely these leaders were suited to be champions during this difficult time. So I'd like to welcome to the screen Jorge, did you make it? Jorge Figueiredo, excuse me, Betsy France from Path Forward, formerly ASPAN, and Calvin Mainers from Arm in Arm. And I'm sorry, Jorge is from Edo Futuro. So to start us off, Betsy, in our conversations, I really appreciated all that you did in your leadership at Path Forward as a new coming in leader right when the pandemic began. Wow. Can you speak a little bit and share some insight in how impacted frontline staff were in our nonprofits in this time?
Carolyn, I'd be glad to, and thank you so much for including me. One of the things that struck me as we were on our calls is how we were all feeling as if the pandemic wasn't enough, that there was the extra layer of all the horrible murders, and George Floyd in particular, and the anxiety was enormous. The unrest was also just unbelievably never experienced, honestly, by any of us. The workforces became very vocal about inequities, and despite how busy we were trying to figure out COVID, it became crystal clear that many leaders had to immediately address the inequities. We couldn't wait. So, for example, while establishing all these new protocols at Path Forward, we also established a diversity, inclusion, equity, and belonging task force. It was comprised of our workforce to address organizational inequities. We addressed things such as pay equity and policies and procedures. And this group met twice a month for 90 minutes for 18 months and still continues today. So that might be what I would call a silver lining out of it. But boy, 18 months ago, to put those two things together felt like it was overwhelming, honestly, and many of us had similar experiences.
Thank you, Betsy. Thank you for your work and for sharing. So Calvin, over to you. Calvin from Arm in Arm. In my conversations with many leaders of color in putting together this report, the issue of trust in systems and how that was so deeply impacted again for Black and Indigenous and people of color, that was a major theme. Can you share a bit about what you saw and what actions you and other leaders of color took?
Absolutely, and thank you so much, Carolyn. I'm glad to be here. Thank you for your sharing, Betsy, and the great work that you guys have done through the safety net and your efforts during COVID-19. I think I'd really like to start by really using a quote by Jorge, our fellow panelist, and my brother here, when he says that they are me, my staff, and I know how hard it is to be, he says immigrant, but I'll say a Black man in this country. We have experienced much of what we're going through and much of what the communities are going through. We were not going to stop and leave them without support. Nonprofits, especially direct service providers, were extremely hard hit during this time. Right? Individuals who were providing boots to the ground supportive services to communities that were hard hit and in high uncertainty due to COVID-19 and the recent murders of Black men by police have been extremely challenged due to the community's lack of trust in current systems. The distrust was fueled by doubt of local leadership's ability or willingness to support them during these times of increased unrest. The brunt of these frustrations was often aimed at the direct service providers who found themselves conflicted because they were now in the situation of having to get out in the community and provide much needed support to individuals who may not even be receptive to their assistance. Hence, what we had to do at this time was work without walls, Carolyn. We had to meet individuals' needs right where they were, both figuratively and literally, outside in parks, at storefronts, store parking lots, church steps, and during walks in the community. This work included collaborating with the local church to make and distribute masks. It meant having information sessions with seniors and youth alike on the fact that the masks distributed could be washed and reused, and that they needed to be worn properly in order to be most effective. Other community efforts included collaborating with Virginia Hospital Center, Emergency Room, and Detox Unit to get individuals into detox and on into alcohol and drug treatment at the National Capital Treatment and Recovery Center, formerly Phoenix House, and other facilities that were still receiving patients at this time because many had closed their doors in uncertainty. By God's grace, these implementations were successful in reestablishing trust in arm services and the authenticity of our direct service delivery. And it is still being used in certain areas today. Trust in our current systems, however, is still a work in progress. We cannot expect this work to be changed overnight. So we continue to strive. Thank you.
Thank you so much, Calvin. Thank you so much, Betsy. These are absolute conversation starters, not finish, right? And we have a long road to go, but the wider we can open our eyes and listen and learn from each other, hopefully we can keep going down that road in the right path. So thank you again for your work. I'll be back with you both in just a minute. So while the report highlights the ways that needs really soared and deepened during the pandemic. So Nancy White of the Arlington Free Clinic and Deanna Ortiz from Doorways are going to talk with us a little about how the uneven and disparities that we saw in the ways people were impacted among racial groups, and hope to help us better understand how these existed before COVID, but how they got so much bigger. So I think Deanna, you're going to start.
Thank you. And Nancy and I will go back and forth a little bit in our time here. But as Calvin so eloquently mentioned it, the challenges that we observed and we witnessed, and these needs that our clients came to us, the disparities were there before. This was not a new crisis. This was not something that just happened when COVID hit. You know, we often talked about how COVID had impacted all of us, which is it's truth. However, the devastating consequences of this health crisis and pandemic had made incredibly challenging what it was already difficult for many of our low-income households that we all saw and continue serving. So again, these challenges that we observed and we were able to witness were not new, but what COVID did was it exacerbated them, it made them worse, and it really cleared all the white noise that it may have happened and made a clear distinction on how also these challenges are interconnected for all the households that we serve. As you know, like my colleagues have mentioned, the safety net is not new and it's been working. It's been collaborating for so many decades. And one of the big initiatives that, again, with the support of the Arlington Community Foundation, we were able to participate and it's still going, is Bridges Out of Poverty. For some of you that are not familiar with that, we learn how, again, these challenges are all interconnected. So a clear example that many of us may remember is the window, the woman in the window, and how, one woman's window is broken by an accident, and she's confronted by the property manager with a repair fee of $30. Being worried about being evicted and what this means, she desperately hands over the cash that she has. And what we don't know is that that's all the cash that she had for her transportation to go to work. And without having that cash in hand, she needs to go and look for a ride. But then she's late to work, so her shifts are canceled. And that becomes a snowball effect of what she cannot afford. So with that, she can no longer afford childcare. And with that, she literally loses her job, and she's confronted with the fear reality of probably being evicted. Many of us might be thinking, well, that's not true, or like it's not legal, or there are options. But this is the reality of our clients, or the trauma that impacts them. It impacts their reality. And that's what we saw. So our partners, we have lots of window stories, lots of examples of a woman in a window and how the pandemic really connected all these challenges in a very devastating way.
Great. Thank you, Deanna.
So I'm so excited that Deanna mentioned that example, because it's true at Arlington Free Clinic every day, that we saw even before the pandemic that very often their lives were like a house of cards, and that if one card gets pulled out, everything can fall apart. And the fragility that we see is just so pronounced, is so different from our lives. And in our cases, sometimes it was something as seemingly simple as a chemotherapy appointment, or a day when someone was simply too sick to go to work, or it could be a flat tire. But one incident like that could be enough to result in job loss, and perhaps eviction or housing instability, or people that decide that they need to save money for rent so that they go without food, or they eat, they're sort of the cheapest meal available at the fast food. And that's not good when you're dealing with health issues. But when the pandemic started, of course, exponentially, everything was worse. Literally all of our patients, to the end, lost their jobs during the pandemic. Most of them were in front-facing jobs like restaurants and childcare and office cleaning, and those jobs simply went away. And so most of our patients also were not eligible for unemployment and didn't know how to get assistance. And so as a result, they would try to save money to not lose their apartments, and would go without food. And they were, perhaps struggling with a mental health problem, and were afraid to go wait in lines for food at the food pantries, as we all were. And so just the stress and anxiety that they were dealing with was just so critical. And then as the pandemic began to recede, at one of the several recessions we've seen, and the jobs started to come back in, they also were faced with the fact that schools were not in session. So not only did they not have a safe place to leave their children, they also were needed at home to assist with the education of their kids who were being taught virtually. And so that was an additional strain for them, for those of us who could, simply open our laptop and work side by side of children who were being educated virtually. These individuals didn't have jobs that could be done remotely. And so they really were, even more stuck. And have been so struck by the interconnection between all of these factors.
Right. Thank you both so much. And I think you hit on so many important parts for more conversation, but just illuminating how little things can really become just cascading through someone's life when you're on such a thin margin of resources. And we saw that so vividly in this past 18 months. And so again, thank you to every single person who's joining us today to learn about this, because all of these organizations, all 21 of them, so need your help to continue to get people out of these very, very deep holes that were created by the sustained time of compounded hardships. Thank you a lot, Nancy and Deanna. We'll see you both again. Appreciate your time. So we've talked a lot so far about things that went really well, and a lot really did go well. But we did also have some parts that, as a collective, we ran into some walls, or we had some pieces that didn't flow quite as smoothly. Andrew Schneider and Allison of Arlington Thrive and Allison Ertl are going to speak with us about one of these, and looking at, as Deanna and Nancy just portrayed for us, how quickly things can compound and create really big issues for people. And one of the recommendations in the report is sometimes we feel in our community there's a gap in collaboration between some of our largest decision-making entities, with the county leadership and the schools. So this is an important one. So Allison, you first in sharing with us and looking at your work with the public schools during the pandemic, what were some things that you saw in their response?
So, I'll just start first, Caroline. As an Arlington funder, we've been doing this work for over 50 years and sort of our family for much longer, all in South Arlington. And we have a history of working with all communities all over South Arlington. But, in particular, I was struck by sitting in with all the safety net calls each week, which I think was unique for a funder. I was grateful that you all allowed me to be a window into your world, because that's something that's so critical to a funder's work, and it makes us understand what the gaps are, and we can take our perspective, knowing that I work with 60 nonprofits organizations in South Arlington, and say, I see that problem here, 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 and here. Let's get together and try and solve it. That's what we do on a regular basis. When I saw this week after week, and I'm going to focus in on the schools and on this. And so, I know there's some school representation here on the panel, and I'm happy to talk with anybody, as we all are later on. This is all about solutions. But, we had to think creatively about the gaps and the needs. And I saw incredible acts of heroism by individual principals, the PTA, social workers, leaders with school affiliations, thinking of Abby Raphael here, and of course, Wendy Curia, community groups, and nonprofit organizations, working in support of school-age children and families. Overall, though, we found that from a leadership perspective, there were some really systemic and issues and gaps addressing three major areas: digital access barriers, food security, and childcare. We've already talked a lot. I've heard from a number of us already that, these are for communities that were already behind, right? They're already in danger of falling back in education. They're already in danger of having their budget fall apart. So food has to go, or something else have to give in order to meet housing. So, we were dealing with that, and just it felt that everything was so slow. And I know that we were all making decisions on the fly, but there didn't seem to be a big collaborative involvement from APS outside with the county to say, hey, even though we're not in school right now, we still need to support these kids who are the same kids that belong to the families that the Free Clinics managing and Path Forward's managing, and all these other nonprofits. Just felt like there could have been a stronger. And Andrew, I know you had a big part just talking about the childcare. I'll throw to you to talk through that area.
Thank you.
Thanks, Allison, and thank you, Caroline, and thank you to everybody who kind of contributed to this conversation. And I think, to reiterate the positive, we did develop a lot of deeper relationships on a staff level between APS and the safety net. And I don't think those relationships are going away, and I'm grateful for them. I think for anybody who's been working in accounting for any number of years knows that the dysfunction and collaboration between the schools and the county was not something that we were able to overcome during the pandemic. We continued to see incredible both dysfunction and lack of innovation in terms of really big problems. And this is historical. This is something that's been going on even before I was working in the safety net. And I think there are a lot of people who could give their own specific examples, but Allison talked a little bit about the technology and the food issues, but really there were issues related to childcare and even school-age children that were not able to get access to services that many of our neighboring jurisdictions were able to figure out, in which the state government and federal government were encouraging in many different ways, such as opening up schools and letting our most vulnerable children, roughly about a third of our children, are on free and reduced lunch in Arlington Public Schools. So that implies some level of vulnerability to having access to the same level of services and stability that maybe not a one-to-one, but we know that children could have benefited by using schools and other county facilities more effectively for alternative locations. And we know that some organizations like APA and Arlington Presbyterian Church and Aspire worked so hard, really much harder than they should have had to have worked, to create these learning pods and to create alternative locations for children that they were working with. So in the end, they were able to help dozens, if not hundreds of children, but there are thousands of children at risk and who will continue to be at risk for the rest of their education here in Arlington because of the gaps that were created or exacerbated during the pandemic. And so I really hope that going forward, the lack of really the spirit of collaboration and the lack of innovation, not from the line and the staff folks, but from the leadership, frankly, of the schools, both on the political side and on the senior staff side, will use this as a learning opportunity to say to not let this happen again, because there's so many ways that we can look to our neighboring jurisdictions and internally, because we did not have a shortage of ideas. What we had was a shortage of can do and let's get it done. And I think that is something that we have to think about going forward from all of us. And I'll turn it back over to, and the only other thing I'll say, Caroline, is that we know that this is connected to the entire safety net, just like Deanna and Nancy were saying. Of the people that are out of work that Thrive helped last year, which is about 50% of the people we helped are still out of work, 40% of those people are citing the lack of affordable childcare or childcare when their children were home, of being able to go back to work, which is directly leading to evictions. So this is not just an education issue, this is an economic issue. So thanks.
Thank you. And why the call for large scale resources, and why we look to the leaders of these entities, because that's where these resources could come. So about 15 seconds, Allison. I'm sorry, we still have so much to get to.
No, you're good. I think Andrew summed it up. We had a lot of things planned, but I think I just hope to see that we can really figure out a solution. While I love addressing the gaps that I find in APS, because it brings me joy to bring something to children that that is much needed. I think having not a funder who's kind of popping in every once in a while to figure this out, that we can look at it more broadly across the system and say, how can we do this better? Thank you. Great,
you guys. Thank you so much. There's definitely a lot to look at there. And again, a conversation starter, not a finisher. So another big topic that we've touched on a bit here, but one of the recommendations from the report is really taking a lot of the years that we've been doing and some of the initiatives mentioned, Bridges Out of Poverty and Destination 2027, to promote racial equity. How do we bring that even more to action? So Nancy White of Arlington Free Clinic is back with us, and Elizabeth Baldrama Jones of OAR of Arlington, Alexandria, and Falls Church. Thank you, leaders. Nancy, you've been a part of so many community-wide initiatives to address racial inequities. Can you tell us a bit about these and where you feel we need to go now?
So one of my interesting roles over the past few years has been part of Destination 2027, looking at the health equity needs in our community, and I was involved specifically with the subgroup that looked at data and lack of data or need for data. And so this whole discussion's been really interesting to me. And I think that very often what we find is that the discussions around equity and disparities are often met with calls for, we need more data, or we need more studies, or we need more planning and all of that. And I think that from what we learned from Destination 2027 is we aren't lacking in the data. It's always, there's nothing wrong with data, there's nothing wrong with planning, but there is enough data out there that we can act now. For example, we have data that clearly shows, and it's divided by census tract, it's aggregated by race and ethnicity and income levels and neighborhoods, that shows that there's a 10-year difference in life expectancy simply based upon the neighborhood in which you live. Additionally, there's an 8-fold higher rate of asthma among our Black residents as compared to white residents. And our Hispanic residents are 11 times more likely to lack health insurance than our white residents. So, those sorts of data pieces, and that become actually very granular, are enough for us to be able to say, we're starting to it's time to start with some action. I also find that, even though, again, there's nothing wrong with data, there's nothing wrong with planning, that sometimes these calls for data end up being calls for, vendors and contractors and long drawn out data assessments. And then what I find in our particular situation is that many times these surveys and these needs assessments skip the lowest income neighbors, because those are the people that don't go to the website and fill out forms, or they don't necessarily use emails, or they don't have the English fluency or the literacy levels to be able to complete these. And so very often those surveys may miss the people who really have the answers, or that hold some of the data that would affect the outcomes. And so, but I do think that we really need to think and pause about on this before we jump in and act. I also think that it's important too that we recognize that as a community, as an example, many of our low-income residents work in jobs that are very different from ours, where it's really difficult for them to have to take a couple of hours off to go sign up for services, or to go for an eligibility appointment, or take their, as low-income people tend to do, take their paperwork and go sign up for services in different waiting rooms, and often to find that they're in the wrong place with the wrong forms and the wrong line. And our need to open up our eyes to different ways of providing this, both by using technology as well as considering extended hours that make this available, just as an example of something that can be done now and make a difference. And I'd love to start to see changes that are being made based on the existing data.
Thank
So
you,
thank
Nancy.
you.
Thank you. Yeah, thank you for spelling that out so clearly and getting us to action. Elizabeth, your perspective is so 360 on this issue. And in addition to growing up here in Arlington, you're a leader of an organization that is deeply committed to racial justice and liberation. What are your thoughts?
Yes, thank you again. And I'm just really grateful to be included, and also for, in addition to what Nancy said, plus the rest of the group that's spoken already. Yeah, so I came here when I was a little girl, and I was 9. I came to Buckingham Village, went to Boston area in the mall, and Barrett Elementary School, et cetera, Gates of Boston, all those things. And I'm very lucky to be able to be part of OAR. And as you mentioned, OAR is all about racial justice. So we are about liberation, we're about collectiveness, and we put participants first, non-dominant, pro-Black, about radical joy and love. And we've been doing that since 2015, even before the recent work and conversations around the difficulty and the killings of Black, Indigenous people of color. So to really accomplish that, we really had to look at the non-traditional things. So like really, as the report talks about, is we got to toss those traditional things away and find ways of doing things differently. And so, one of the things that we do is we make sure we lift up the voices of individuals who are directly connected to the community, which I think is also really important, not just who the loudest voices, but really the individuals who are the most connected to the community. We also make sure that folks feel like they are loved enough to share their opinion, that they are, as Nancy mentioned, in a position where they can come at a specific time, or they can do it virtually, or they can do it, and that they are also paid for their expertise, right? So all of those different things. And so as the community is thinking about equity and racial justice and liberation, I want folks to really know that the communities that we're coming from, I was from, there's a lot of language around like at-risk communities or poor communities or communities lacking X, Y, and Z. And being from all those communities, the reality is that I've never heard any one of my neighbors or myself said, hey, do you know we live in an at-risk community? Like, we just don't do that, right? And so language matters and language is important. And so ensuring that we are all caring for each other. And what I have though heard in those communities is, does Arlington really care about their Black, Indigenous, and people of color? Do we really care? And if so, why are we not budgeting and investing in the communities accordingly? So I think that's a really important point as we think of what the future holds for us.
Right. And action, not words, but action to convey that. Beautiful job, both of you. Thank you so much. And hopefully we have a lot of wheels turning on this. Elizabeth, please stay with me. And you'll be joined, Nancy, thank you. We'll be joined here with Vardaburgi from the Arlington Community Foundation and Elizabeth to talk about one of my favorite things that we really took off on is the giving of unconditional cash and trust-based philanthropy. In this pandemic, every organization found a way to get help, whatever was needed, to our participants. And there were record levels of gift cards and donations and without strings attached. And it was just an incredible thing. I heard something said the other day that I just love, that rather than having a safety net, we need to build a launching pad and turn it into a launching pad where people can get out of these situations and not get trapped in it. Anne and Elizabeth, I know you each have a lot of thoughts on this. Anne, we'll start with you. What is the Community Foundation doing and where is unconditional cash showing up right now in Arlington?
Sure. Well, as you just teed up so well, Caroline, we did see countless examples of how effective, less prescriptive funding going to the nonprofits as organizations and to individuals, how important that is. So the report described how challenging it was to meet the huge volume of need to get food on the table. And we all know that AFAC is clearly the ongoing reliable anchor for our supplemental food safety net before the pandemic, during, and going forward. We saw those beautiful endeavors by the PTAs and the churches to stand up food pantries and restaurants delivering meals. But it became clear that people were still struggling. People were struggling to get to some of these pop-up opportunities. And they also were missing out on the choice they needed for key dietary items that they needed for their families to meet their needs. And so we believe that the flexibility of gift cards for people to be able to purchase groceries to supplement what else is available in this important network of services is a really important part of the puzzle. And I believe the Food Security Task Force is looking at this as an important complement for some populations. And then looking beyond the food needs, the wider spectrum of needs, the pandemic has really accelerated the spotlight on the value of regular, predictable cash with no strings attached for people that are living on the edge day to day. And this is the basis of our growing guaranteed income movement across the country. And even prior to the pandemic, the Community Foundation and our county partners have been looking at places like Stockton to say, hey, let's test unconditional monthly cash as a way for households to fill their gaps as they know how to best. So we're really excited. In August, we were able to launch Arlington's Guarantee as a guaranteed income pilot here to test this. And so that's on the household level, but on the nonprofit level, we also saw that flexibility in funding to these organizations here is really important. And it was important to rise to the occasion of the pandemic. In March of 2020, local funders and donors just hustled to get needed funds more quickly to the nonprofits and with less cumbersome processes and more flexibility and fewer reporting requirements. We know that nonprofits have enough on their plates and do not need to take time away writing long reports to funders. So moving forward, we really hope that we and other private funders, as well as the county, can really use these flexible strategies for people and for the nonprofits to support them in ways that really maximizes trust and dignity and personal agency and economic mobility. And Elizabeth, I'm sure you can fill in more there.
Thanks, Anne.
Oh my goodness. Carolyn and I were both giving rounds of applause as executive directors and CEOs of nonprofits in our lives or in our previous lives. And just exactly, you know, there is nothing like having to work around the clock to ensure that somebody can get into housing and have food and have the transportation they need, get specific. And then also we have to write reports to our funders. That is like a 15-page report, right? And so I'm really grateful that many of our funders and other members of the community have chosen to give at an unprecedented level with less and less restrictions, which is so key. And that then also leads me to
income.
That also then leads me to the reality of how we want to then do that as a nonprofit, right? So we at OAR, the goal, so the things that Anne was talking about with unconditional income and grocery cards and giving money to individuals, the cash transfers concept. So that is actually something that is going to work. And it's going to work enough that at some point, none of us in the nonprofit field want to exist forever, right? So nonprofits were established because there was a need. And once that need goes away, we don't have to be here anymore. Right, so OAR is going to be 50 in 2024, and our goal is to stop existing as soon as possible, but certainly not another 50 years. And that will be because the needs are met, and we will all actually be starting at the same level in the community. And so what we did at OAR was, because there was such an unprecedented level of need during the pandemic, we said, you know what, we have to figure this out and continue to put participants first. And so we got a huge number of folks who were being released from incarceration. We got a huge number of folks who were coming to us that had already been in services, but they lost their jobs, et cetera. And we had families that were coming to us. And so we wanted to make sure that we figured out what to do. And unfortunately, as part of our budget, we had to actually lay off half of our full-time staff because we wanted to make the hard decision to ensure that participants had what they needed. And so, as Anne mentioned, with dignity, we honored people when they said, hey, I need this. And we thought, yes, of course, you don't have to fill out 1,000 forms. You don't have to tell us how the money's going. Like, yes, here you go. If you're asking for the money you need it, we believe you. And so that was part of really how we transitioned. And then we started giving out laptops and cell phones because the digital divide is real, right? Mm-hmm. And so we started doing all these things that we knew that folks were going to need: debt repayment, housing, food, everything. And together as a safety net, I think we all did the best we could in that sense and really came together and changed our practices, as was said earlier. And you know, I'm just really grateful that that the community came in to support financially and with their spirits, and that they will continue, hopefully, to advocate for things like cash transfer and unconditional income.
Excellent. Thank you so much. This is so exciting. And the thing I wish that we had a way to convey for our audience today, the faces of participants when we tell them they don't have to bring back receipts and proof and the change that it makes in their life right there in that moment. They feel instantly empowered and respected, and they're experts in solving their problems, and they really, we saw this really take hold. So we hope the community will come with us and keep running in this direction. Thank you so much, Anne and Elizabeth. Last group, we're going to have to catch up because we've got some incredible questions here in the question line. So Jorge Figueredo from Edo Futuro, Diana Ortiz from Doorways, and Debbie Taylor from National Capital Treatment and Recovery. Joining us for our last section here, which we will try to do in just about 5 minutes time. But we'd like to talk about the role of public-private partnership. And this is really just so integral to all of our work, because I hope we've made our point that things are so interconnected, and our partnership with the county and government agencies is just so essential. And It was so, where it was effective during this time, it was so effective. So Jorge, please start us off, and glad you could join us. How were some things that you saw at Edo Futuro around public-private partnership, and things that you think we want to think about going forward?
Yeah, thank you so much. As you know, Edu Futuro had become one of the largest providers of emergency assistance in the whole Northern Virginia region. And one of the things that worked the best was when we worked together with Arlington County Department of Human Services, when we worked with other nonprofits. And what we did was to leverage the resources that were in existence. So by doing that, we were able to help many of the families that needed the assistance the most. And as you know, the highest rates of infections and hospitalizations happen among the Latino community. But that is because many people don't realize that they are a large group that represents the essential force. So if they had a job, they will be out there maintaining our hospitals, the grocery stores, the pharmacies, and many other critical institutions. One of the things that we did is that as we were helping the families and assisting them with the navigation of wherever the services were, we also had our own emergency fund. So whenever there was a situation where the family needed immediate emergency assistance, we will go ahead and deliver that. We partner with APA, we partner with other groups too, for the learning pods, and also with our case managers. The one thing that I can tell you that made us to be so successful is that it is because we do not only serve these communities that were most heavily impacted, but also because we ourselves are part of these communities. I think that one of the important keys here is that our staff, bilingual, bicultural, they were able to provide rental assistance and also work many hours, helping to close many cases where the parents needed to find ways to identify, obtain, translate, upload documents, and other very difficult documents that they didn't know how to do. So it is important to recognize that organizations led by people of color and communities they serve are better equipped to provide the needed assistance for the communities that are hardest to reach for our mainstream organizations. Plus the fact that Arlington County has to look at us as a subject matter experts rather than merely beneficiaries. I think that's something that was learned through this pandemic, is that we step up to the challenge. Therefore, I will encourage Arlington County to identify ways to create dedicated funding streams to provide support and building capacity for organizations that are led by people of color. So these type of private partnerships, public-private partnerships can happen.
Thank you so much, Jorge. Thank you so much for sharing with us. And I know that there's some conversations already in motion on this front, so we'll be excited to see where our community goes. Thanks.
Thank you, Carol.
Deanna and Debbie, finish us up here. So I think another big piece of public-private partnership, and something that we really took some steps forward on, was understanding that nonprofits do a lot for our participants, but we also need money for infrastructure. We really leaned into this to go virtual, to keep open, to afford PPEs for our staff. So many things come in that bucket. Deanna, what are some thoughts that you have regarding?
Sure. So I think we've learned a lot. The gift, or again, looking at things, hindsight, while still being during this crisis, help us understand that we truly are better than just the sum of parts. We're more than just, a few collective. We multiply and amplify. County alone would have been really difficult. Nonprofits alone, we really need that support of our county and our local governments to see us as partners, and to see it as, many times on a weekly basis, we sat at the table to really see what was going on and how quickly we could respond. Because this is our bread and butter. We're crisis responders. So once a crisis happens, we're ready as we could be. We could do it fast, and we could do it well, and we can learn from these experiences. We could also invest in what is oftentimes what it's called indirect or operating costs. We did it really well, but we could have done it so much better if we would have had the technology from the beginning, or if we could have had, again, the infrastructure that is really needed. So we're not scrambling or starting from the negative. So I think like there is a lot of good learning and how we, again, this partnership can continue, how we can be stronger together, how we, as, you know, as Jorge mentioned, as Elizabeth, as again, our colleagues have mentioned, we're here for the same cause. Different missions specific from nonprofits, but we're all on the same team. We all want this community to succeed. We all want everyone to start from an equitable point, and we can do it with a true partnership.
Great point. Well done. Thank you, Deanna. So Debbie, final word before you get started. I just want to remind, we've got some great questions in the Q&A. We're going to be moving to those after Debbie speaks. So please add yours if you have them. All right, Debbie, final word on this front. What are your thoughts on public-private partnership?
Thank you. It's essential. It's essential to the people who live in the community. The things that we thought we knew that we didn't know. The question that I had when my young Black men would say, I don't know that I can come to work. And I'd say, well, we're all vaccinated. We're okay, assuming that it was COVID. And then to be told, well, oh, it's not that, Debbie. I'm afraid to drive in the traffic because of what just happened to George Floyd, on top of everything else. So you go into these things thinking that I've been around 100 years, I know all of this. And what I don't know is what came forward in this COVID crisis. It brought forward the gaps that we have that we can enhance. We can fix and we can make things better. I think with the American Recovery Plan Act, there are dollars there. We were so fortunate to be eligible for federal dollars. And without those federal dollars, we wouldn't have been able to stay open because we had to cut our census. None of our staff left. All of our staff were paid. We were able to figure out ways to change their schedules so that they could be home with their kids, but still be at work. You know, that took tremendous ingenuity. And I think with this extra funding that exists in the county, we have to be very wise to figure out how can we improve the expertise of the nonprofits so that these folks who are disadvantaged, not just economically, but also through equity and racial issues, can actually rise to the top. That's the goal. So I'd like to thank you for allowing our conversation, and I'd like to thank the group for allowing me to participate with all of these experts. So thank you very much.
Thanks so much, Debbie. Wow, I have never had 45 minutes fly faster in my life. That was a lot of ground to cover. Thank you all, you're amazing leaders. And I feel so proud to live in a community where each of you and your staff and your missions are making such a difference. So thank you all. So everybody, please turn on your cameras and join me. We've got some really thoughtful questions here. So let's see if I can do this. My multitasking. One of the questions is asking, increasing locations for food distribution seems to have been a key part of promoting equity in food access. That's really true. Are there any ideas for something similar that could be done related to healthcare? So I think perhaps Nancy and Betsy, you all might each have some things to say on this that we're doing to try to address access to healthcare in our community. Betsy, do you want to go first?
Sure, I will. And actually my part dovetails beautifully into Nancy, because I love that question, because that's what one of the things we all learned is how can we distribute the services or be there for the people that need us when they can't get to us. And we noticed at Pathwater, tremendous inequity around access to healthcare. So I actually called Nancy, and I called the hospital, and I called, DHS, and thought, can we be a scout for you with outreach? Because we have an outreach program in place. Could we be a medical scout for you? And we've put into place a mobile medical program where think of it as Amazon. We're bringing backpack medicine to the streets, to the people that need it. And And what we've discovered in that is that it's just another example of how we all can work so beautifully together. We don't need 6 of us doing it. And we don't have at Path Forward all the answers to what we're finding on the street. So by working with Nancy and others, it's been a beautiful strengthening of the safety net. And the winners are those that are getting vaccinated or getting socks or getting food, whatever it might be. So it's just, we started this in July. We literally just put a backpack on our back and out we went. And it has taken off, but we have saved lives. And I think there are many more to be saved. So I'm extremely excited to share that and was very grateful for that question. Nancy, that sort of dovetails into what you guys have up your sleeve,
Well,
right?
I think one thing that this brings to mind, I think you have to be an optimist when you're in this work. And one thing that, and this ties in with the public-private partnership that I think worked really well during the pandemic, was the flexibility of the public health division in meeting the needs. When COVID first started and the first testing sites started up on North Quincy Street over by Washington Liberty High School, the message was, come in your car, stay in your car, bring your insurance card, bring your doctor referral, and bring your ID. And so I talked with Dr. Varghese and I said, our patients don't have cars, they don't have IDs, they don't have insurance cards, and they don't have doctor referrals. But so we need to get this testing over here because that's where the COVID is. And within a week, that was that a testing site was stood up at Arlington Mill Rec Center, and over 13,000 people had been tested just in that next 6 or 8 months or so. I think the same thing happened with vaccines, is that we were I saw so much flexibility in terms of where should these sites be. An important partnership between Neighborhood Health and Macedonia Baptist Church, and to be able to have a vaccine site here at the clinic, not only for our patients, but for their friends and their families and their neighbors, to make it convenient to do it on Saturdays, to do it in the evening. And I think that there was that real spirit of what do people need and what do we need to do to make that happen. And I still see that on the vaccine front. We'll see it again as the little children get vaccinated, to see that real sort of, what we would call patient-centered, but real resident-centered decision-making that's so important. We've got a really rich safety net, including Path Forward, the Virginia Hospital Center sites, both at the hospital and the pediatric center, Neighborhood Health, and a fairly robust bus system to be able to get people around. It's the important thing is working together to make sure that people know where to go, when, and how, and what that roadmap looks like. And so that's the topic, sort of, as we hopefully move out of the pandemic, and to sort of say, what have we learned? So
great. Thank you both. All right, so we've got just a few minutes left. So this is a long one, but Andrew, Deanna, and Jorge, one of our participants is curious, with the eviction moratorium over, where are people now with respect to their stability in housing and rental assistance? So Andrew, do you want to start, and then maybe to Deanna and Jorge to close us up?
Sure. I think we could all answer this question because I think we all have similar visions of how to answer it. I think the reality is that we have learned that during the pandemic that we have required extra flexibility and extra time, as Anne referred, that getting people back to a pathway to stability is not just point in time, momentary crisis aversion, but really working on stability. It's a multifaceted approach that is not going to be just one thing. It's not just going to be cash for a sustained amount of time, or helping people eviction, or helping people with food. It's the amalgamation. And I think the reality that we are dealing with here in Arlington is that housing is going to, and the high cost of living is going to continue to be an incredible driver. And as long as there is not an increase in supply that outpaces the loss of supply, that constraint is only going to increase. And we are going to lose people from our community who cannot wait for us to figure it out. And we will have richer and richer people and fewer people who are on the edge. And we will have to think as a community, what are the implications for that? If that the only people who are working in our community can't afford to live here, well, that is something that we have to come to terms with, about our values and our tax dollars and our resources and our
Right.
philanthropic dollars. So I'm sure a lot of smart people are on the call who might have other answers, but I think the fundamental thing is that none of these things alone are going to be sufficient to stop people from not being able to stay in Arlington.
Right. Thank you, Andrew. Deanna, like 15 seconds, what are you seeing in terms of people's ability who are experiencing housing instability and homeless now? How are they?
Well, the crisis is not averted. So I would just say that we will continue seeing it. There has been monumental efforts by the county and again, the nonprofits to prevent evictions. And that's been fantastic, but the crisis is not averted. What we've seen in the domestic violence side of it, the lethality of families now seeking help because they feel that now they can go out and reach out. We've never served so many households like in this past year in domestic violence and safety and lethality. So the crisis is not over and we will continue seeing what the impact is.
Thank you, Deanna. And Jorge, I know that in the communities that your staff and your case management team has been working with, there are a lot of people who have a lot of fear, as Calvin explained and shared so clearly around trusting the help that was there. Are there people still with really high balances and who are really at risk of eviction because of delayed rent pay?
Yes, definitely. This is something that it has not stopped. And like Diana said, it is going on. We have assisted many families as much as we can, but the reality is that they are leaving the county. The reality is that we already had cases where, in fact, we have to pay for their truck, we have to pay for the deposit for their first month, and we have to pay for the storage facilities and their first month of rent. And they are now moving to Prince William County. They are moving to areas where are more affordable because they cannot do it here in Arlington. So it is not gonna stop. The issue and the challenges are still there. And like Andrew said, this is a challenge that is not only on one aspect. It's not only housing, it's not only childcare, it's all together. And then, yes, we have to ask ourselves the question, you know, morally speaking, what is what we want? What is the type of Arlington that we want? What is the type of community that we want and live in? So those are very important questions that we are still many years ahead to be able to resolve it. But the key here is that we need to start working on it now. We cannot wait any longer.
Thank you so much. I cannot believe how quickly this time went, but I send my deep gratitude to every single one of you who participated and came to hear from these incredible leaders. At the back of the report in the appendix, you can find how to contact these organizations and also get involved and find out for yourself just how amazing the work being done is. And they need your help. They're as strong as the people who support them. So please get involved. And final words, I'd like to extend our sincere gratitude to the team at the Arlington Community Foundation as well. Ann Vardaburgi, Nick Knock, Natalia Munoz, you guys have been incredible in pulling this project together. And to all 21 Safety Net leaders who gave me so much of your time and your insights and your candor. Hopefully we've been able to share with our community things that no one could see, that just felt so significant and so huge for such a long time. Thank you for coming through this time with strength and such clear vision. And I know that I look forward to being a part of this community that together we are shaping. Thank you all.
Thank you, Carolyn, for everything you've done as well.
It's been an honor and a pleasure. And we wish everybody a wonderful fall day. And again, thank you for our time, and please follow up with these incredible organizations. Thanks.
Thank you, Caroline. Thank you, and thank you, everybody.
Bye, everybody. Take care.
Take care.
Bye.
Thank you.